People have often asked me, since I have a tracheostomy tube and ventilator, what do I bring with me to the emergency department? And also, what do I bring with me to the hospital? So first of all, if I'm going to the emergency department, I often have a bag packed with things that I need. For example, I have all my essential medication in there. I know once I get to the emergency department, they are very, very busy and they probably are not going to be able to get me the medication that I usually take. So for this reason, I have a bag full of medication that I use. I often update this quite frequently to make sure that the right medication is in there, and also to rotate medicine through that, because obviously if you put medication in the backpack and then you don't use it for a year, that medication's getting old. So every couple months I rotate out the medication to make sure there's fresh medication in there, and then I take the older medication and I take that, so I get that out of my supply. One thing I bring with me, not only to the emergency department, but everywhere I go, is called an obturator. This is needed to help insert a tracheostomy tube. It goes inside the tracheostomy tube like this, and then it provides a nice smooth rounded tip, and this allows the tracheostomy tube to be inserted safely, easily, effectively without it. The edge of the tracheostomy tube can get stuck when going into the tracheostomy site, and so this is really needed. I also keep this handy because my pulmonologist many, many years ago told me she actually uses this in the intensive care unit to clear out tracheostomy tubes. If there's a clog in the tracheostomy tube, you can just actually insert the obturator. This will clear out the clog, and then now you have established a clear tracheostomy tube. Now you can breathe again. I did this once in the emergency department. I wouldn't recommend keeping the tracheostomy tube in your airway, because I did this and it was a hard clot, or a hard mucus plug. So I pushed it through. Well, then it went down into my lungs. And so it hit my carina, which caused me to cough, and it kept hitting my tracheostomy tube, hitting my carina, hitting my tracheostomy tube, hitting my carina. Oh my goodness, it was like a ping pong ball in my airways. And finally, I just had to rip out my tracheostomy tube, and then I coughed out the mucus plug. Yes, that did work, but I wouldn't suggest that. So now what I do is if I get a clog in my tracheostomy tube, I actually take out my tracheostomy tube, take it out, insert this not in my airway, get the clog out, take clean paper toweling, get the clog out, and then just reinsert the tracheostomy tube back into my airway. So I always carry an obturator with me. The other thing I also carry right with my obturator is lubricant jelly. If you can see this lubricant jelly, this is needed because you put this on the end of the tracheostomy tube, put it on the end, and then that helps glide the tracheostomy tube into the airway. You don't necessarily need lubricant jelly to insert a tracheostomy tube, but lubricant jelly makes insertion of a tracheostomy tube so much easier, less painful. If you don't use it, it can tear the tracheostomy site and cause bleeding. Lubricant jelly is your friend, and for this reason, I always carry these together, except I sterilize this, wrap it up in clean paper toweling, and then put these together in a plastic bag. Wherever I go, I have these with me in case I need to take out my tracheostomy tube, or for whatever reason, in case my tracheostomy tube falls out. No worries, I can reinsert it at any moment. The other thing I always take with me, of course, is my ventilator. I always take with me my heated humidifier. I know you're thinking, oh, well, you're going to the emergency department, you don't really need it. Yes, I actually do, because the emergency department is very, very cold. And I cannot tell you how many times I've gone to the emergency department and I'm just shivering and freezing. That cold air is absolutely miserable. So I always take with me my heated humidifier. With my heated humidifier, I also have, this is actually sterile water, but I just use these small containers, and this either has sterile water or distilled water for my heated humidifier. Yes, I bring with me my own water to the emergency department. Why? The emergency department is very, very busy. You have no idea how long you might wait in the waiting room. You have no idea when you get back to the emergency department if there's respiratory around, if they're able to get you your water. They might have a lot of things going on, and for this reason, I always carry my own water with me. I do keep track of how much water I use. So whenever I see that there's a respiratory therapist around, or if I see there's kind of a break in the action of the emergency department, I will ask a nurse for sterile water so I don't run run out of my own water. And you think, well, why don't you just run out of your own water? I have done that. And unfortunately, it's kind of presented a lot of issues because I'm out of water and now there's nobody around and I don't know where it is in the emergency department. So then I don't have water for my heated humidifier and then my airways dry out and it's miserable. So I always take some with me, and then the first available chance that I have that I see somebody that can get me more, I always request more, and then just basically use the water they give me and keep the water that I brought with me as a emergency supply. And I constantly try to get more and more water replenished to prevent myself from running out of water in the emergency department. Most other things in the emergency department I don't bring with me. For example, I don't bring with me gloves because I know they have them in the emergency department. They're usually on the wall and it's not a big deal. Also, I do not bring with me like suction catheters. I don't think it's really necessary. If you have a lot of mucus and you're constantly suctioning, maybe you want to bring along your suction machine and a suction catheter. But I find it not necessary because most of the time they get me back in the emergency department, even if it is a couple hours, it's not a horrible long time. And then once they see I have a ventilator and a tracheostomy tube, respiratory is always called, and they're usually in my room rather quickly. So if I need suctioning, I can ask them and they're able to get me the supplies. So I don't feel like a suction machine and a suction catheter are necessary. Some other things that I really don't think are necessary. For example, I don't think some of the like gauze and things are necessary. If you use gauze around your tracheostomy tube, they have gauze in the emergency department. So if I need gauze, I just rely on that. So I'm trying to think anything else. Oh, the one thing I actually do bring with me are these saline bullets. So you have these saline bullets and you might think, why do you bring these with you? They have them. Yes and no. I've actually had a lot of difficulty getting these saline bullets at the hospital. It depends where you are. Intensive care unit, I tend to get these really easily. In the emergency department, maybe sometimes, not always. So I actually bring a couple of these and I put it with me with my ventilator. I have it in my ventilator bag with me. Now, I don't usually, when I go to the emergency department, bring with me a spare tracheostomy tube. I know a lot of people do. I have so much stuff. So I have my ventilator. I carry my heated humidifier. I also use IV nutrition called TPN. So I have that with its pump. And then I have a bag of supplies with me. And I have my my backpack with all my medication. And I have so much stuff. I feel like I can't carry anymore. So before I leave home, or I should say, like right now, I get a bag together. So if I ever have an emergency, I have an emergency bag sitting there for one of my parents to take it to the hospital if I need additional supplies. So what do I put in my emergency supply bag? One of the very first things I put in there is a spare tracheostomy tube. Yes, you're going to the hospital, and yes, they should have your tracheostomy tube, but they don't always. They might not have your size. They might not have your specific kind. I always bring my tracheostomy tube, spare tracheostomy tube with me. I don't bring it with me to the hospital because it's just too much stuff, but I put this into a bag and I keep it for my parents in case I need it. Another thing I bring with me is I bring with me extra tubing, ventilator tubing circuit, because I have had my tubing circuit fail in the hospital. Things have happened. So I have that in a bag. Another thing I also keep in the bag is another water chamber. I'll show you. I just keep it in the box. So here's another water chamber. I just keep it in the box. It's just much more convenient. And you think, don't they have water chambers? Sometimes. And sometimes it's really hard to find water chambers because they don't always use these water chambers. They sometimes use bags that have a spike and they use a different water chamber. So I will sometimes switch over to the bag with the spike using their water chamber if getting sterile or distilled water in the hospital is difficult. It sometimes is. They only have sometimes those bags, those IV bags. So you have to switch water chambers. But in general, I take this with me so I have it because you never know. Crazy things happen that they don't have your water chamber. The other thing I bring with me are heat and moisture exchangers. You are probably going to have to be disconnected sometime, maybe even in the emergency department, maybe in the hospitalization, to go to either X-ray, CT, ultrasound, who knows where we're going to go, and you have to be disconnected from your heated humidifier. The hospital is cold, and so this is called a heat and moisture exchanger. You can put it into your circuit line, and then this retains moisture and heat. It helps prevent your airways from drying out. Now, some people actually bring with them a different circuit. This is called a dry circuit that detaches from your heated humidifier, and then they just use this to be transported through the hospital. I don't, because this is just another thing to bring with me. Wherever I go, I actually make them take my heated humidifier with me. But whenever they turn off my heated humidifier, I just attach this heat and moisture exchanger. I just attach it in line, and then that way I have the heat and moisture exchanger. It's keeping me warm. And then if I do get someplace, for example, radiology, and there's a wait for radiology, I will say, hey, there's an outlet over there. Can we go plug in? So they will plug in my heated humidifier. When they do that, I take off the heat and moisture exchanger, because you shouldn't have this on with the heated humidifier running. So sometimes that happens that you're waiting for a test. So then I'm like, hey, turn on my heated humidifier, please. And then as soon as they disconnect me, I put this back on. This saves me a lot doing my heated humidifier and the heat and moisture exchanger, switching them out. It saves my airways so much. My airways dry out a lot in the hospital. And I constantly get mucus plugs in the hospital. Now, another thing I bring with me, and I don't bring it with me to the emergency department, but as soon as I get a room in the hospital and have kind of room to spread out, I will have one of my parents bring with me my nebulizer. So here is my nebulizer, and you might think, oh, they have those wall nebulizers at the hospital. Why don't you use those? I've had so little success with those wall nebulizers. I'm not sure why they function differently, but whenever I do saline through the wall nebulizer, my mucus does not thin out. It still remains thick and sticky. So after my last hospitalization, when I was in the emergency department, I was like, Mom, please bring me my nebulizer. So now we have a protocol in place that if I go to the emergency department, if I need to be hospitalized, I will have my nebulizer brought to the hospital. Thankfully, I always keep my nebulizer out in my room, so it's pretty easy to see my nebulizer. It's always out because I'm frequently using it. So I just have one of my family members disconnect the nebulizer from the wall, wrap it up, bring it to me, and then I use it while in the hospital. Those are pretty much all the items I bring with me to the hospital. So again, for the emergency department, I just bring my medication, an obturator, lubricant jelly, and my heated humidifier, my ventilator, and also sterile or distilled water. And then once I'm actually hospitalized, I have additional things brought to me. I have a heat and moisture exchanger brought to me, a spare tracheostomy tube, my nebulizer, just water chamber, just things you might need in the hospital. However, I don't bring things that are first aid, such as I don't bring gloves, I don't bring gauze, I don't bring anything like that. I don't actually even bring the trach tube ties, because I find the hospital always has trach tube ties, so there's really no reason for me to bring my own. So those are some things I bring with me. Also, I'm going to give you this tip. If you get hospitalized, please always ask that they have your size tracheostomy tube and a tracheostomy tube one size smaller in your room, ready, easily accessible, because if something happens and you get, mucus plug or it disconnects, your tracheostomy tube pulls out, something happens and you need an emergency tracheostomy tube exchange, you need these tracheostomy tubes right there, right accessible. And if they don't have your tracheostomy tube, you're going to need to bring that from home. But I always suggest people trying to get the tracheostomy tubes through the hospital, simply so they know what size you're using, what size they need, what size is one size smaller. It helps keep everybody on track versus like, oh, I'm just gonna bring all my home supplies. Yeah, that's great, but make sure they know what you're using, because if you're not around, or if a parent's not around, or somebody's not around to help guide them, they might mess up and put in the wrong size tracheostomy tube, or just might mess up somehow. So make sure you discuss with your medical team, with the respiratory therapist, let them know what supplies you need, and then also find out if there's any supplies they do not carry. If you are changing an inner cannula, for example, and they do not carry your inner cannula, you're going to need to bring that with you to the hospital. If, for example, you use a special size suction catheter and they don't have that specific size at the hospital, you're going to have to bring that with you to the hospital. Hospitals carry a lot of things, but they're not a full supply company, so there might be things you use, even your tracheostomy tube, they might not carry. So you need to clarify that with everybody. Don't assume because you're in a hospital, of course they should carry that. Maybe, maybe not. We hope they do, and they probably do, but things happen. Maybe they run out and they forget to order things, or maybe they don't usually carry that. So make sure you're on the same page with everybody. What supplies are you going to be needing? What supplies can they provide you? And what supplies you're going to need to bring from home or from a medical equipment company, or you're going to have brought into the hospital. So thank you so much for joining me. Please remember to like and subscribe down below. Please also remember to comment and share. It really helps my YouTube channel. I hope you have a great day and a wonderful week. Bye-bye.